Have you ever seen your parents or beloved grandparents get tired easily or become short of breath while doing light activities? We often dismiss it as a normal part of aging. But did you know this could be a sign of a problem with a very vital organ, the lungs? Hello everyone and welcome back. In this video, we're going to discuss a very important yet often overlooked topic: why lung diseases so frequently affect the elderly and how we can protect them and even ourselves in our later years. We will cover everything from how to manage the illness if it's already occurred, how to prevent it, to the right dietary patterns. Make sure you watch until the end. First of all, let's understand why the elderly are more vulnerable to lung diseases like COPD, chronic obstructive pulmonary disease, pneumonia, or worsening asthma. Before we continue, let's break down each of these lung diseases that are so common among the elderly. 1. COPD, chronic obstructive pulmonary disease. Obstructive means there's a blockage. Chronic means it happens slowly and over a long period. So, simply put, COPD is a condition where there's a blockage in our lungs that makes it hard to breathe, and it doesn't happen suddenly, but over many years. Imagine our lungs are like balloons. Healthy lungs are elastic. When you blow them up, they expand, and then they can deflate perfectly to push all the air out. Now, the lungs of a person with COPD are like a rubber balloon that's been used for too long. It can expand when we inhale, but when we exhale, it can't deflate completely. So, there's always some stale, dirty air trapped inside. What's the result? You become short of breath and winded because the lungs have to work extra hard to get the old air out and bring new air in. And the main cause? You don't have to look far. Over 90% of cases are due to COPD's best friend, cigarette smoke. In essence, COPD is like having worn-out lungs from years of exposure to smoke or pollution, making the process of exhaling very difficult. The two most common conditions that fall under COPD are chronic bronchitis and emphysema. Chronic bronchitis. This is when inflammation and narrowing occur in the bronchial tubes, the airways to the lungs. This condition causes excessive mucus or phlegm production and a chronic cough. Emphysema. This is a condition where the small air sacs in the lungs, alveoli, are damaged or destroyed. This damage reduces the surface area of the lungs and the amount of oxygen that can enter the bloodstream, making breathing very difficult. COPD symptoms develop slowly over many years, so they are often unnoticed until significant lung damage has already occurred. The main symptoms include a shortness of breath, dyspnea, especially during physical activity, a chronic cough that doesn't go away, often called a smoker's cough, the excessive phlegm production, which can be clear, white, yellow, or greenish, wheezing, a high-pitched whistling sound when you breathe, a feeling of tightness in the chest, frequent respiratory infections, fatigue or lack of energy, unintentional weight loss in advanced stages. Moving on to the second disease, pneumonia. You've probably heard of this one more often. It's sometimes called wet lung. Why is it called that? Because that's literally what happens. Imagine the tiny air sacs in our lungs are like millions of mini sponges. Their job is to absorb oxygen from the air. Well, when you get pneumonia, these mini sponges get flooded. Not with regular water, but with fluid or even pus due to an infection. Germs, either bacteria or viruses, attack and throw a party inside our lungs. If the sponges are soaked, how can oxygen pass through and be absorbed? It's difficult, right? That's why the symptoms include a high fever, as the body fights the germs, a cough with thick phlegm, and chest pain with every breath. The difference from COPD is that pneumonia comes on quickly and suddenly, like an uninvited guest who immediately causes chaos. This is not a chronic disease, but an acute infection that needs prompt treatment. In essence, pneumonia is an infection that causes the lungs to flood with fluid, disrupting the process of oxygen absorption. Symptoms can range from mild to severe, depending on the type of germ, your age, and your overall health. Sharp chest pain when you breathe in or cough. A productive cough, with phlegm that may be greenish, yellow, or even bloody. High fever, sweating, and chills. Shortness of breath or rapid, shallow breathing. Extreme fatigue and loss of appetite. Confusion or changes in mental awareness, especially in older adults. Nausea, vomiting, or diarrhea. Last one, asthma. Many of us might have been familiar with asthma since childhood. Asthma is a different story. Imagine our airways are like a water hose. For a normal person, the hose is the right size. But for someone with asthma, this hose is sensitive and easily irritated. The slightest trigger, like dust, cat dander, cold air, or even stress, causes the hose to react immediately. The muscles around it tighten, the inner lining swells, and it produces a lot of mucus. The result? The opening of the hose becomes very narrow, like a hose that's being squeezed. Now, worsening asthma or an asthma attack is when this hose gets squeezed so tightly that it's extremely difficult to breathe. Air struggles to pass through, which is why you hear that wheezing sound, the chest feels tight, and you cough uncontrollably. So, the main problem with asthma isn't in the air sacs like with COPD or pneumonia, but in the airways, which are prone to narrowing. In essence, asthma is a condition where your airways are super sensitive and easily narrow when exposed to certain triggers, which makes it hard to breathe. Symptoms of a worsening asthma attack. An asthma attack can be a medical emergency. It's crucial to recognize the signs. Severe shortness of breath, making it difficult to speak, eat, or sleep. Wheezing and coughing that won't stop. Chest and neck muscles feel tight when breathing. Breathing becomes very rapid. The color of the lips or fingernails turns pale or bluish. A reliever inhaler, the blue one, provides no relief or the effect is very brief. So, do you have a clearer picture of the differences now? Even though the symptoms are similar, they all cause shortness of breath. Their causes and how they work inside our bodies are very different. By understanding these differences, we can be more alert and know when to seek help immediately. Okay, let's continue with why the elderly are more vulnerable to these lung diseases and how to prevent them. There are several main reasons. 1. The natural aging process. As we age, our respiratory muscles, like the diaphragm, can weaken. The lung tissue also loses its elasticity, making it harder to expand and contract efficiently. As a result, the lung's capacity to hold air decreases. 2. A weakened immune system. The body's ability to fight off viral and bacterial infections naturally declines in old age. This is why infections like pneumonia or the flu can be far more dangerous for the elderly compared to younger people. 3. Lifelong accumulated damage. Imagine our lungs as a filter. For decades, they filter various pollutants from the air we breathe. Exposure to cigarette smoke, both active and passive, air pollution, dust, and workplace chemicals accumulates and damages the lungs slowly but surely. So, what if our parents have already been diagnosed with a lung disease? Don't lose hope. There are many things that can be done to manage their symptoms and improve their quality of life. Remember, the first and most important step is to always follow the doctor's advice. Here are some common ways to manage it. First, adherence to treatment. This is crucial. Ensure that the elderly use medications like inhalers or nebulizers according to the prescribed dose and schedule. Don't stop the treatment without the doctor's approval, even if they feel better. Second, pulmonary rehabilitation. This is a program specifically designed for people with lung disease. It usually includes breathing exercises, safe and light physical exercise, and education about their condition. The goal is to increase the strength of respiratory muscles and stamina. Third, breathing techniques. There are two very helpful techniques. 1. Pursed lip breathing. Inhale slowly through your nose for 2 seconds, then exhale slowly through pursed lips, as if you're about to whistle, for 4 to 6 seconds. This helps release trapped air from the lungs. 2. Diaphragmatic breathing. Place one hand on your chest and the other on your stomach. Inhale through your nose, feeling your stomach expand. Exhale slowly through your mouth, feeling your stomach fall. This trains our main breathing muscle. Fourth, avoid triggers. Cigarette smoke, dust, pet dander, and pollution are the main enemies. Make sure the home environment is clean and free from these triggers. Lastly, don't forget the power of what we eat. The right foods can be a shield for our lungs. What are they? Antioxidant-rich foods. Antioxidants fight inflammation and cell damage throughout the body, including in the lungs. Increase your intake of berries, strawberries, blueberries, apples, and dark green leafy vegetables. Omega-3 fatty acids. Omega-3s are known as natural anti-inflammatories. The best sources are fatty fish like salmon, sardines, and mackerel. Cruciferous vegetables. This vegetable group, like broccoli, cauliflower, and cabbage, is rich in antioxidants and has been shown to help cleanse harmful substances from the body. Beneficial spices. Turmeric, with its curcumin, and ginger have powerful anti-inflammatory properties that are excellent for respiratory health. Adequate fluids. Drinking enough water throughout the day helps keep the mucus in your airways thin, making it easier to cough up. And what should be avoided? Limit processed foods, fatty red meats, fried foods, and sugary drinks. These foods can trigger inflammation and worsen lung conditions. So, in conclusion, maintaining lung health in old age is a collective effort that involves early detection, proper management if you're already sick, and most importantly, a preventive lifestyle. Remember our 4 main pillars from today. A. Know the risks. Understand that aging makes the lungs more vulnerable. And manage well. If sick, adhere to your doctor's treatment and do pulmonary rehab. Prevent actively. Avoid smoking, get vaccinated, and stay active. Eat smart. Consume foods rich in antioxidants and anti-inflammatory properties. Health is the best investment for a happy and high-quality old age. Let's take care of our lungs and the lungs of those we love. Thank you for watching. If you found this video helpful, don't forget to hit the like button, share it with family or friends who might need it, and subscribe so you don't miss out on other important health information. Write in the comments section if you have any questions or other topics you'd like to discuss. See you in the next video.